All right, let's dive in. Today, we're talking about a really transformative shift in how we approach healing and support. It's a framework called trauma-informed care, and it's completely changing fields from healthcare to education, all by asking one simple, fundamentally different question.
For decades, whenever systems, schools, hospitals, you name it, run into challenging behaviors, the default question has always been this one: what's wrong with you? It's a question that immediately starts looking for a problem, a defect, inside the person. But here's where everything changes. Trauma-informed care flips that script entirely. The whole idea hinges on this simple but incredibly profound shift in perspective. To this question instead: what happened to you? That one little change reframes the entire conversation, moving it from blame to genuine understanding. And to really see why that is so crucial, let's take a look at what happens when systems don't ask this question. To really get a handle on why this shift is such a big deal, we first have to understand how systems that lack this perspective can, even with the best intentions, end up causing more harm. So, first things first, let's get on the same page. What do we even mean by trauma? Well, according to the American Psychological Association, it's an emotional response to a terrible event. And the key thing to remember is that it can have these lasting impacts on a person's well-being, physically, emotionally, all of it. It's not just about what happened in one moment, it's about the ripples that spread out long after. And this isn't always just an individual thing. Trauma can be systemic. It can be baked right into our society. Here's a powerful example. The National Institutes of Health points out how huge policies, like the war on drugs, actually created historical trauma, which then fueled racial bias and discrimination that has impacted entire communities for generations. And the consequences of that? They're profound. That historical trauma doesn't just fade away. It creates these very real walls. We're talking about deep emotional pain, a powerful and frankly understandable mistrust of the healthcare system, and a reluctance to get help for things like substance use, often because there's a very real fear of being prosecuted. Okay, so in response to these exact kinds of problems, experts started to build a better way, a new framework designed to create safer, more effective systems. This is the real how-to guide for putting trauma-informed care into action.
It's known as the 4Rs, and it was developed by SAMHSA. That's the Substance Abuse and Mental Health Services Administration. So, step one, organizations have to realize just how common trauma is. It's everywhere. Step two, they need to learn how to recognize the signs, not just in the people they serve, but in families and even in their own staff. Third, they have to respond. That means weaving this understanding into every single policy and practice. And finally, and this is so important, they must actively work to resist re-traumatization, making sure they aren't accidentally making things worse. And what's so amazing about this is that the 4Rs aren't just for therapists. This is a full-blown revolution happening across tons of different fields. So let's actually see what this looks like on the ground. Get this. In a school, a teacher uses this approach to help a distressed student calm down instead of just punishing them. In a hospital, a doctor actually changes the way they communicate to build trust. In law enforcement, an officer can handle a domestic violence call with greater sensitivity. Even in an office, it could look like flexible schedules to support an employee going through a tough time. It's incredibly practical. This side-by-side really makes it crystal clear. So in a traditional scenario, a doctor might see an anxious patient and just label them as difficult or non-compliant. But with a trauma-informed lens, that same doctor recognizes the anxiety might be a sign of trauma, and so they adjust their approach to build trust and make the patient feel safe. See the difference? The change isn't in the patient, it's in the provider's perspective. So when you zoom out, you realize this is about so much more than a new set of rules. It's about building an entirely different kind of environment, a true culture of care that benefits absolutely everyone involved.
And the results? They really do speak for themselves. Organizations that make this shift see things like better staff morale and way less burnout. For the people they serve, it means safer environments and, you guessed it, better outcomes. It really is a win-win that just fosters a much more collaborative and supportive culture all around. This quote from National University just hits the nail on the head. It's all about making sure everyone's needs are met with sensitivity and respect. This isn't just about patching up old problems. It's about actively building a more compassionate and empathetic future. So we end right back where we started, with that one simple, incredibly powerful question. It's a shift from judgment to curiosity, from accusation to compassion. And it kind of leaves us with a final thought to chew on. In our own lives, in our workplaces, and in our communities, how could asking what happened truly start to change our world?